In this tutorial, I will discuss the osteology of the humerus bone in detail. Humerus bone is the bone of the arm. First, we will find out where it is the right humerus or the left humerus. So for this, you need to hold the humerus in the anatomical position. This is the anatomical position of the humerus. The coronoid fossa and the radial fossa should be on anterior and the head of the humerus should be on the medial. So it is the right humerus. For humerus bone, you should know that there are two important views. One is the anterior view and the other one is the posterior view. So we will begin with the anterior view. This is the proximal part of the humerus and this is the distal part of the humerus. Beginning with the distal part, this is the capitulum, trachea, medial epicondyle, lateral epicondyle, coronoid fossa, radial fossa, medial supracondylar ridge, lateral supracondylar ridge. These are the parts related to the distal part of the humerus on the anterior view. Now let's come to the proximal part. Head of the humerus, anatomical neck, surgical neck, greater tubercle, lesser tubercle, intertubercular sulcus. Now let's come to the shaft of the humerus. On the shaft of the humerus, we have three borders and three surfaces. Beginning with the borders. This is the anterior border. This is the medial border. This is the lateral border. Now let's come to the three surfaces. Between the anterior border and the medial border, we have the anteromedial surface. Between the anterior border and the lateral border, we have the anterolateral surface. And between the medial border and lateral border, on the posterior side, we have the posterior surface. On the anterolateral surface, there is an important tuberosity that is called the deltoid tuberosity. The deltoid muscle is inserted over here. Now let's come to the posterior view of the humerus bone. This is the radial groove. In the radial groove, the radial nerve runs. This is the olecranon fossa. That's all about the osteology of the humerus bone. I will discuss the muscle, nerves, arteries related to it in other videos. Thank you.